Okay, this is an adult female physical exam. The patient appears to be her stated age and is in no acute distress. I'm going to ask her some questions. What's your name?
Abigail.
Where are you at right now?
Glasgow, Kentucky.
Who's the president?
Donald Trump.
What year is it?
2019.
Okay, great. We're going to start with some vital signs. I'm going to have you sit at the edge of this. Okay. Let me get your blood pressure, your temperature, and then we're going to check your pulse, okay? Oops, sorry. It was 108/74, which is good. I'm going to take your temperature and we will get your pulse at the same time, okay? Okay, your pulse was 66 and temperature was 97.4, and both of those are great. And you're breathing about 18 a minute, so that's great as well. First thing I'm going to do is I'm going to sit over here and we're going to look at your head, and I'm going to feel your head with my hands, okay? You tell me if there's any pain anywhere, okay? No pain? All right, so I'm going to get my pen light. We're going to look in your eyes and make sure that your pupils are reactive. Okay, now what we're going to do is I'm going to have you follow this light. Okay. Okay, good. And then what we're going to do is I'm going to have you look at this silver thing and you're going to follow it. Okay, perfect. Now what I want you to do now is to touch your nose with your hand and then touch my hand with your finger. Okay? Okay. Touch your nose. Good. Okay, now I want you to do it one more time. I'm going to have you touch your nose. I'm going to have you close your eyes and then touch my palm. Okay? Great. Okay. So now we're going to do a vision chart, and I'm going to have you cover up one of your eyes, and then you read the lowest line that you can read. QCPOF. Okay, now cover your other eye. QCPOF. Okay, now look with both eyes. QCPOF. Okay, great. So now what we're going to do is I'm going to look in your mouth. And your nose also. Okay, open up. Say ah, ah. Look at your teeth. Great. Okay, I'm going to look at your nose. That's good. So I'm going to look at your ears as well. Look on the outside. That looks good. Okay, they're clear. Okay, great. I don't see any redness, so that's good. All right, so then we're going to, I'm gonna have you stick your tongue out and move your tongue from side to side, up and down. Okay, great. I'm gonna check your neck out and feel with my hands, okay? Is there any pain anywhere? No? Okay, can you swallow for me? Can you swallow one more time? Okay, I'm gonna go behind you and do the same thing, okay? Okay, now swallow. Good. I'm going to take my stethoscope and we're going to listen to your carotid artery. Okay. just feel your pulses in my hands, okay? Now I'm going to rub my fingers together and you tell me if you hear them, okay?
Yes.
Are they the same on both sides?
Yes.
Great. Okay, now what I'm going to do is I'm going to take a listen to your lungs. You just sit there and breathe normally, and every time I touch you, you take a deep breath in, okay?
Okay.
Great. Okay, the next thing I'm going to do is I'm just going to touch your chest, and you tell me if you have any pain anywhere, your shoulders or anything. No pain?
No pain.
Now what I'm going to do is I'm going to listen to your heart on this side. We're going to listen to it twice with each side of my stethoscope, okay? Okay, great. Okay, I'm going to have you turn around with your back facing that way, okay? Take a look at the back of your neck. Any pain on your shoulders? Want to touch you? Okay, I'm going to touch down your spine very lightly. Any pain?
No.
Okay, I'm going to touch a little bit deeper. Any pain with that?
No.
Okay. Now I'm going to have you tell me if you feel pain with this, okay?
No.
Nothing?
No.
Okay, and I'm going to ask you to say 99 every time I touch you, okay?
99. 99. 99.
Okay, the next thing that I'm going to do is we're going to have you turn your neck side to side. Okay, any pain with that? Okay, can you twist your waist side to side? Okay, and then I'm going to do it for you, okay? So you tell me if there's any pain?
No.
No pain? Okay. Twist, good. Good. Okay, now I'm going to listen to your lungs on this side. And breathe every time I, there you go. Good, perfect. Okay, so then I'm going to have you lay down, your head up there, yeah. Feet flat, you're good. Okay, I'm going to look at your abdomen and make sure that there's no abnormalities that I see. So everything looks good. I'm going to touch you with my hands, okay? You tell me if you're hurting anywhere. It's light palpation. Okay, now I'm going to do deep palpation, okay? Is there any pain anywhere? Okay. I'm going to listen to your stomach. When's the last bowel movement that you had?
This morning.
Okay, perfect. Okay, great. Now I'm going to touch you again, okay? You tell me if this hurts anywhere. No pain? Okay, I'm going to have you take a deep breath in and hold it. Any pain with that? Okay, let go. You're good. All right, so now I'm going to listen to your pulses on your abdomen as well. Okay, go ahead and listen to your femoral pulses, okay? Okay, now I'm going to see if I can feel your pulse in your abdomen as well. Sorry, I'm hurting you. Okay, I'm going to check for your lymph nodes. Any pain? Okay. Check here. Any pain with those? Any sinus pain at all? Any pain down through here? No? Okay. So the next thing we're going to do is we're going to do your range of motion in your legs, okay? And I'll lift this up. We're going to just look at your legs. And I'm going to have you bend your knees. Good. Now twist your ankles like this. And I'm going to do it for you. Go back down. I'm going to do it for you. And you tell me if you have any pain. Okay. Any pain? No. Good. Okay. And then same thing on this side. I'm going to do it for you. And then I'm going to have you do it yourself, okay? Let's see. Okay. And then you. Go ahead. Perfect. Okay. Now I'm going to feel your pulses.
My stomach's making some noises over here.
Okay. Alright, so the next thing I'm going to have you do is I'm going to have you sit up and we're going to sit in this chair. Okay, I'm going to fix the camera so that way we can see. What's going on this way? I think I can see it that way. Okay. And I'm going to have you push up against my push. Good. Now pull back. Good. Great. Now push. Okay. And pull back. Great. Okay. The next thing we're going to do is I'm going to look at your arms. We're going to test your reflexes. Okay. Okay. I'm going to check your pulses. So the same one. Make sure they're even on both sides. And they are. Okay. Great. Okay. So I'm going to do range of motion as well. I'm going to move it and then I'm going to ask you to move it. So your wrist, shoulder, everything. Okay, now you do it. All of it. Great. Other side, I'm going to have you do it for you and then you do it yourself. Okay? Okay? Okay, now I'm going to do your reflexes. Okay, while I have you here. Just dangle your arm. Ready? Okay. I'm going to do your shoulder. Okay. Same thing on this side. Okay, great. So I'm going to do your knees with this. There you go. Okay, same thing. Okay, and then I'm going to check your reflexes on the bottom of your foot, okay? Okay, perfect. And the next thing we're going to do is I'm going to check your capillary flow on your hands. Great. And I'm going to make you flip your hands out like this. Keep doing that. Great job. And then we're going to test and see if you have a sensation, okay? So I'm going to grab something. All right, I'm going to grab other stuff. So what I'm going to do is I'm going to make this vibrate. I'm going to place it on your head, and you tell me if you hear any sound, okay?
Okay. Yes.
You feel, what do you feel?
Vibration.
Okay, we'll do the same thing. You tell me what you feel.
Vibration.
You hear anything?
Yes.
Hear that?
Yes.
Which one's louder?
The second one.
Okay, we'll do the same thing on this side.
Okay. Vibration. Second one.
Second one's louder. Okay. So we're going to do the same thing, and I'm going to have you close your eyes, and you tell me if it's vibrating or not, and tell me when I stop the vibration, okay?
Okay. Vibration. Stop.
Okay.
Vibration. Stop.
Okay.
Vibration. Stop.
Okay.
Vibration. Stop.
Two more.
Vibration. Stop. Vibration. Stop.
Okay. And then keep your eyes closed for me, and we're going to I'm going to put two objects in your hands, and you're going to try to tell me which ones you think they are. Okay, just hold out your hand for me. Okay. What do you think that is?
A key.
Okay. So let's fix this camera back. Okay. Perfect. Keep your eyes closed. And what do you think that is?
An ink pen.
Okay, perfect. Okay, and then I'm going to test another sensation. You're going to keep your eyes closed, and you're going to tell me where you feel me touch you, okay?
Okay.
And I'm going to keep your eyes closed, and we're going to do a sharp and a dull test. You tell me what you feel is sharp and if you feel it's dull.
Dull. Sharp. Dull. Sharp.
Okay.
Sharp. Sharp. Sharp.
Okay.
Dull.
Okay, cool. All right. So the next thing we're going to do is I'm going to have you stand up, and you can open your eyes now. I'm going to have you stand up, and you're going to walk like normal, okay?
Just over here.
Yeah, just anywhere. Okay, great. And then stop, and then we're going to walk back heel to toe. Let me turn this towards them so they can see what you're doing. Heel to toe. Any dizziness with that?
No.
Okay. I'm going to have you stand straight, look at me, and close your eyes. Any dizziness with that? Oh, okay, great. All right, you can sit back down if you want to. And okay, this concludes the physical exam on a male. I would have done a full genital exam with palpation. On a female, I would have done a full pelvic exam with the speculum internal and external, and also a full breast exam with palpation on both. Thank you.